Good morning again. Thank you for joining us. The spring before my freshman year of high school, I started to get sick a lot. And a lot of doctor's appointments and tests later, I was diagnosed with leukemia at Lucille Packard Children's Hospital at Stanford in California. And there I underwent 130 weeks of chemotherapy, and life has never been the same. I'm Constanza Rader, and I'm an arts and health and nonprofit consultant. And one of my passions is supporting adolescents and young adult patients, or AYAs, by improving the systems that treat them. Having cancer as a young person, it just hits different. And there's a lot of disruptions for a teen or young adult with cancer that add to the already high burden of just having cancer. And as you'll learn today, there are many preventable barriers that exist between an AYA and a successful outcome. Every 39 seconds in the United States, another young adult is diagnosed with cancer. And these patients are between the ages of 15 and 39, and they fall in this gap between pediatric cancer and older adult treatment and care. And they often receive treatment that's ill suited for their unique biological and psychosocial needs. Now, despite being 6 times more prevalent than pediatric cancer, AYA cancers receive disproportionately less attention and support. I know we're not as cute as the little bald kids, but there's a lot more needs in this demographic that are going unaddressed right now. This lack of specialized care contributes to stagnant survival rates and long-term quality of life issues for AYA cancer patients and survivors. I was lucky because I received the support I needed and have now been cancer-free for almost 23 years. So, thank you. And today we're going to explore how we can collectively move barriers so that every AYA can receive a timely diagnosis, appropriate treatment, and the practical support they need to navigate the dangerous waters of AYA cancer. Like I said before, you can follow along with us in our virtual flyer here. You can scan, or you can scan the program on your table. Now, back in the day, I spent many years working with AYAs in hospitals as a bedside musician and as a peer. And it was there that I met Dr. Jaime Estrada, a pediatric oncologist. And instead of slowing down in retirement, he decided to just keep going. And he started the AYA Cancer Foundation of San Antonio to continue to support AYAs in practical ways. Please join me in welcoming him to the stage, the man who brought us together today, Dr. Jaime Estrada. It's a long walk to the stage.
Thank you, Constanza. I'm going to do my 10,000 steps just going from the table to here. Good morning. I think it's still morning. Yeah, 10 minutes to noon. Thank you all for attending our annual Luncheon. As Constanza said, after retirement, I founded the AYA Cancer Foundation in 2018 with a dedicated team to fundraise and address the financial and psychosocial challenges faced by AYAs. And now we know what AYAs means, right? Adolescents and young adults. Our board at the time decided to tackle the two major financial issues that AYAs with cancer face by providing AYAs with something rare among cancer nonprofits: immediate cash to cover living expenses like rent, transportation costs, utilities, gas, and groceries, and funds to pay for their fertility preservation procedures. So far, we have awarded 99 grants for living expenses and 14 fertility preservation grants, totaling around $220,000. Thank you. We are now receiving requests for financial assistance from social workers on behalf of patients being treated at MD Anderson in Houston and other Texas locations, including El Paso. There is a great need for financial assistance in AYAs. Your support is crucial now and in the future. Today, we are launching the AYA Support Network, partnering with community resources and organizations to provide wraparound services to help ease the financial and psychosocial, psychological burdens of our young cancer patients. Now, I'd like to recognize and thank some of our key supporters here today. First, I'd like to thank our sponsors, University Health, our presenting sponsor. Thank you for your continued support. Hope Hits Harder Cancer Foundation, and our friends at the Methodist Healthcare Ministries of South Texas. Also, thank you to all the organizations and individuals who sponsored tables. I'd like to thank our board members and the members of our planning committee who put together this event. Thank you, Constanza, for doing a great job conducting the orchestra. Next, I'd like to recognize and welcome Dr. Robert Alan Romas, Dean of the UT Joe and Teresa Lozano Long School of Medicine. Guest of our longtime friend and supporter, Mr. George Hernandez, former CEO of University Health. Also with us today, Dr. Gail Tomlinson, Division Chief of Pediatric Hematology and Oncology at UT San Antonio. Dr. Tomlinson also serves in our board of directors. Thank you, Gail. Now I'm happy to recognize, is she here? Councilwoman Dr. Adriana Rocha Garcia from District 4. Yeah. And our friends, Elizabeth Lutz, CEO of Bexar County Health Collaborative. Evelyn Delgado, President and CEO of Healthy Futures of Texas. Where are you, Evelyn? Thank you. And Bill Neely, Executive Director of San Antonio Community Resource Director, or SACRED. Thank you, Bill. I would also like to recognize our exhibitors and representatives from our support network partners, Tribewell Cancer Foundation. Leukemia and Lymphoma Society, the San Antonio Food Bank, University Health, Catholic Charities, and the City of San Antonio. Thank you. This event is also a celebration of our young cancer patients. If you are an AYA patient or survivor, please stand up and be recognized. Thank you. Finally, and now the medical professionals who care for them, physicians, social workers, nurses, please stand. Thank you. Finally, we all play a vital role in helping AYAs with cancer to survive and thrive. I would like to invite you all to become part of this community. I want to thank each of you for taking time out of your Saturday to attend this event. Thank you.
Thank you, Dr. Estrada. You're going to be hearing about AYAs, but it's one thing to hear about it, it's one thing to hear from an AYA. And last year we heard a little bit of Ryan Clay's story during our panel discussion at the last luncheon, but we wanted to hand over the mic to him again this year to give us a little bit fuller picture of his experience because it's so representative of many AYAs in our community. So Ryan is a 36-year-old PhD candidate in molecular and cellular biology, studying lung cancer metabolism at UT Health Science Center. He actually recently presented his research at the American Association of Cancer Research's annual meeting in Chicago. And before that, he graduated from the University of Central Florida with a bachelor's and master's in biomedical science. So he is a cancer researcher that 3 years ago, was also himself diagnosed with cancer and survived leukemia. So please join me in welcoming Ryan Clay to the stage.
How's everybody doing today? So when I got cancer, I was shocked at how quickly my health declined. I had just moved to Texas in January 2022 after my mentor, Dr. Luncheon, was offered a promotion to relocate his lab to San Antonio from the University of Florida. I had started my PhD in biomedical sciences in 2019, and when I was given the option to either transfer with him or to stay in Florida, I didn't hesitate to pick up everything and move with him, even though I had no family and knew no one here. I loved my project. My dissertation studies the metabolic regulation of cell signaling in lung cancer. And if I decided to stay in Florida, I would need to switch labs, and I knew I would never find another person like Dr. Jen. So off to San Antonio I went. I had a full checkup in March 22 that showed I was in good health, minus a tasteful amount of diabetes and high cholesterol. I started focusing on dieting and exercise when I was first diagnosed with diabetes 2 years prior. So at this point, I was eating right. I was going to the gym 5 days a week. And then in just 6 months, I went from jogging, lifting weights every day, to not being able to walk across a parking lot or not being able to climb a flight of stairs without losing my breath. My girlfriend Paige noticed my lips would turn gray when I climbed the flight of stairs to her apartment. I felt fatigued constantly. I started sweating through my sheets every night. I initially chalked this up to it just being hot in Texas, but this was excessive. Then I started to develop a strange rash across my legs and my belly. This is when I started to admit to myself that something might be wrong. Then I noticed I would get a cut or pop a zit, and it wouldn't stop bleeding and it would never scab over. Then my vision suddenly declined in my right eye with a cluster of floaters that developed one day that grew overnight to obscure my entire field of vision in one eye, which I would later find out was a hemorrhage. My girlfriend Paige, who I had only met 3 months prior, finally convinced me to go to the doctor. I was able to get a last-minute appointment over Zoom with a PA that I hadn't met before. I described to her my symptoms, and then I turned the camera to show her the rash on my legs, and she said, "Oh my God, look at that." Her first instinct was to assume it was an STD. I insisted that this rash was on my legs and not, in fact, on my groin, but nevertheless, she ordered every STD test under the sun, threw in a blood count just to be safe. I ran over the phlebotomist, and with it being Friday at 4:30 p.m., I assumed I wouldn't hear back from them until Monday at the earliest. Rather, I got a call the very next Saturday before dawn from my PCP. She explained that she had seen my blood panel that came back, and every category of blood cell, red, white, and platelets, were either dangerously low or non-existent. And because I was out of blood, as the experts call it, she told me to go to the ER immediately. Still being somewhat in denial about my situation, I tried to not overreact. I grabbed a cell phone charger and a fresh pair of underwear because you never know. And Paige drove me to the hospital, and I assumed I'd just be there for a few hours, maybe do some tests and come home. And as it turns out, I wouldn't leave that hospital for 35 days. The hospital I chose happened to be associated with Mays Cancer Center at UT Health. Without knowing it, I made a good decision right from the start by going straight to a cancer center for treatment, which many AYAs are not able to do. I dragged myself into that ER and I got a room immediately, which is never a good sign in an ER. I started getting set up with IVs, EKGs, and the works. At this point, I made the mistake of telling the doctor I was a scientist that studied cancer, and from that point on, everyone I met decided they could drop the facade and tell it to me straight. They ran and reran every blood test they could think of. Meanwhile, negative STD tests started pouring in onto my chart. They and I both figured out it was cancer almost immediately, but they decided to keep the diagnosis a surprise until they could rule out any number of other rare conditions that it might be. They would check in every few hours with more and more negative results, and they would leave the room with something to the effect of, this isn't good, right? And I thought, yes, it's good. It's not good to not have any blood. I stayed in the ER until the early hours of Sunday morning. I received several blood and platelet transfusions, supplemented by a constant drip of negative STD tests. I couldn't help but think, at least I don't have herpes, or we can rule out chlamydia. I have to say, I've been in some bad situations in the past, but laying in that bed was terrifying. And when I finally got to a hospital room, my nurse read my chart, saw that I was a science person, and then looked up at me and said, "Oh, so you know. Yeah, I've had 3 family members die from leukemia." By the time I met my oncology team later that morning, I was actually relieved to get my diagnosis, B-cell acute lymphoblastic leukemia. Having a name for it was better than being in the dark. I didn't know a ton about ALL, but I vaguely remembered from my cancer classes that leukemia was one of the few curable cancers. I wouldn't find out until later that my cancer had what's called a Philadelphia-like translocation, which meant that this was the deadliest form of ALL. But since we didn't know that part yet, we made a plan to start chemotherapy in 2 days. I gathered as much courage as I could and called my mom and sister to tell them I might be dying and that they should fly out if they could. Excuse me. I would find out later I was one of the lucky few to have my oncologist consider my fertility before beginning treatment. Apparently, the majority of patients aren't informed before undergoing this form of chemotherapy that they will be sterile after treatment. Being that I was still in school, I had put off having children for a long time, but I still wanted kids someday. The fertility doctor came to visit me in my hospital room. First thing Monday morning, she gave me a cup and a brown paper bag and explained that they would analyze my sperm sample and could store it for up to 10 years. But unfortunately, this exam and the sample storage are not covered by insurance, so I would have to pay out of pocket. And if it weren't hard enough to collect a sperm sample in a freezing hospital room with barely enough blood to maintain consciousness, with an IV in each arm, being surrounded by nurses and cancer patients, imagine the added stress of thinking, how am I going to pay for this? As far as the sample collection went, luckily I've been training for this day my entire adult life. But as far as the bill went, I really had nowhere to turn. As it is, I make barely enough money to keep a roof over my head and buy food each month. And that was before having to pay for copays and prescriptions. My girlfriend, Paige, was unemployed at the time, and my mom and my sister didn't have, $2,500 just laying around. I asked the fertility doctor what I should do, and she gave me a list of charities that I could try to contact for help. Out of the dozens I contacted, only 2 ever responded, and one was a flat-out no. Thankfully, Dr. Estrada emailed me back right away, and he was able to help. The grant Dr. Estrada gave me was critical for preserving my fertility. And funny enough, the lab where I work at today is across the street from the building where my sperm sample is stored. So on slow days, I'll take pictures of the building, send it to my mother, and say, visit your future grandchildren. But those potential grandchildren only exist in the first place because of the AYA Foundation and Dr. Estrada. After the first 2 rounds of chemotherapy, my bone marrow biopsy showed that the cancer wasn't responding to treatment, so we couldn't justify continuing. My next option was an antibody therapy called Blincyto. Aside from the cytokine storm I would experience each time I started therapy, I was thrilled just to be off the chemo because it meant that I could leave the hospital and go back to a somewhat normal life. I was able to carry my drug pump around in a backpack for a month at a time, and I got to spend what I thought might be my last Christmas with my friends. I'm extremely lucky that I was even able to get Blincyto in the first place. It wasn't approved by the FDA yet, so I was using it through compassionate use. I did 3 rounds of Blincyto until it finally stopped working. My bone marrow biopsies had gone from 90% to 0.15% cancer cells, but this still wasn't good enough for a transplant, and I would need another miracle drug. Excuse me. Once again, I lucked out by being one of the first to receive another brand new drug, Tecartus, which is CAR T cells. The collection process for CAR T sucks. They put a giant catheter in your neck. They filter out your T cells over the course of several hours. And the process completely depletes your body of calcium, so your lips and fingertips tingle for 2 weeks afterwards. It only took 6 weeks to get my cells back, which is a miracle of medical engineering. The month after my CAR T infusion was easily the scariest time of my life. I immediately came down with severe cytokine release syndrome, which felt like the worst flu of my life. The hospital was unable to control my fever. I believe it got up to 104, maybe 105. And even packing my body with ice didn't help. I was shivering so violently I couldn't leave the bed for days. I was even shivering too hard to make it to the bathroom on my own, so a nurse had to come in to help. I couldn't even coordinate holding the urinal by myself, so the nurse held the urinal for me, and I proceeded to pee on that nurse. The side effect of CAR T is neurological toxicity. There's a few days after I got the CAR T infusion that I have no recollection of. I'm told I was awake and I could answer questions, but they say I spent most of the day staring blankly at the wall and just speaking in gibberish. To this day, my family won't tell me a lot about what I said and did during that time. For example, I'm told one day I just randomly turned to my mom and said, "Hey, didn't you have sex with one of the Beatles?" She sighed and said, "No, it was Donny Osmond and we just made out." The nurse in the room thought that was the height of comedy. Eventually, my fever came down, I regained consciousness, and I was allowed to go home. The neurological side effects persisted for weeks. I only gained the ability to write a sentence after a month, and it took a good 6 months for my handwriting to fully come back. I can't complain too much because CAR T was so effective that I achieved complete remission in just 30 days, and I was ready for my transplant. The process of preparing for the transplant isn't fun. You do chemo, total body radiation, and testicular radiation, which isn't painful but incredibly awkward. The scariest part about the transplant is that once the infusion goes in, the die are cast, and you either are going to live or die. Every year, there are people who make it to this point just to be killed by their graft. I still get emotional every time I think about my stem cell donor. It amazes me that there are people out there who are willing to sacrifice part of themselves to save someone's life that they don't even know and they might never meet. As far as I know, my donor is an unrelated man from Germany that was an 11 out of 12 match. German law says I'm not allowed to find out who he is or try to contact him until 2 years post-transplant, which is now in just 5 months. When I finally get to contact him, I'm not really sure what I'm going to say, but I hope "Thank you for saving my life" is good enough. The year and a half since my transplant has been pretty rough at times. I've dealt with near constant infections, graft versus host, all while trying to keep up with experiments at work, publishing papers, and dealing with life in general. I'll be forever grateful for Dr. Jen for supporting me through my cancer journey. If it wasn't for him, I would have had to drop out of the program. But thanks to his support, I'll be graduating in a couple of months. Thank you. My girlfriend Paige is here today, and I have to say that I never could have done this without you. I like to say that we have the Benjamin Button relationship because we got the terminal disease out of the way at the beginning. The same goes for my mom and sister, who couldn't be here today, but who flew out from Florida several times to take care of me for the last few years. There's nothing I can say to tell you how grateful I am, other than just I love you guys. And finally, I also have to thank Dr. Estrada and the AYA Foundation of San Antonio again. First, they enabled me to start a family someday soon, thanks to the fertility preservation grant I received. And second, when my medical bills started to pile up after my transplant, they gave me an additional cost of living grant that enabled me to pay my rent and continue buying groceries during recovery. The amount of aid I received totaled just a few $1,000s, which really isn't that much money, but it literally determined whether I ate or not during my recovery. And this shows that your donations can have a big impact on our community. I want to wrap things up by saying that my story isn't unique. As a cancer survivor, I might be the luckiest guy in the world, even though I've been poisoned with chemo, irradiated, operated on. Anyone who's never been through it themselves won't really understand how rough it can be. But despite having decent health insurance, the support of amazing family and friends, and the most supportive boss in the world, I still struggled with many aspects of being a young adult living with cancer. If you remember anything from my story, other than the ordeal with the sperm sample collection, it's that I was lucky enough to get a curable cancer in a town where we have a group like the AYA Cancer Foundation. I hope my story will convince you of the need for rapid, direct financial assistance like what the AYA Foundation of San Antonio provides. In addition to raising the money that will go directly to helping our brothers and sisters in our community, I'm really excited about the new care network that Dr. Estrada and Costanza have worked tirelessly to get off the ground. And for those of you in the audience today, you get to choose to make a difference in someone's cancer journey. Thank you.
Can we all just give him a big round of applause? Thank you so much, Ryan. We all hope stories, AYA stories, end like his, or end like mine, with lots of years of extended life. But unfortunately, that's not yet the reality. Dr. Archie Blair is widely considered the father of the AYA movement. And he was one of our presenters last year and wanted to be with us here today to update us on some latest research. But unfortunately, he had a conflict, but he did send us a video with this short message.
Thank you, Constanza. I'm
You're
sorry
welcome.
I'm not with you, but at least I'm with a YA of the AYA. My 23-year-old grandson is graduating today, in fact, as I speak, at the Pacific University in Oregon. I don't mean it provocative, but the adolescent and young adult research team and I at the University of Michigan and elsewhere have new data that I have to share with you. And it is a matter of some urgency. If we looked at the suicide rate across the United States of all AYAs 15 to 39 years of age, the incidence of suicide has increased dramatically since 2000, especially since 2007 in the United States, and even more so in Texas. If we look now just at those who were diagnosed with cancer those years, and we'll pick 3 years, 2000, 2007, and 2015, 2015 being the latest year in which we have follow-up valuable data, and look first at the 2000 year of diagnosis of AYAs in the United States with cancer, and you can see that after they were diagnosed, that within 6 years, their suicide rate increased about threefold. If we now look at 2007, which is a couple years after the federal assault weapons ban ended, we can come back to that, you see an even greater increase, the brown curve, almost a six-fold increase in the first 6 years after their diagnosis of cancer in 2007. But if we look at 2015, the latest available data for 6-year follow-up, notice the red curve so much more dramatically increased from 0.01 to 0.06, six-fold increase. So suicide after the diagnosis of cancer is much more problematic and increasing more rapidly than we previously realized. Now, if we look at causes of death, other than suicides for now, let's look at all of them, but we're going to exclude the cancer itself, because the cancer eventually kills some people. And then the heart disease, which is often caused by the cancer treatment, usually anthracycline, like adriamycin or doxorubicin chemotherapy, or radiation to the chest, as with Hodgkin lymphoma, breast cancer, thymomas, and other thoracic tumors. If we exclude those two, accidents are definitely the number one cause of death after diagnosis of cancer. And you can see the rapid rate of increase by 6 years after diagnosis. But suicide is the second most common reason for an AYA cancer patient to die, more so than all these other causes. Although interestingly, and this is for both men and women, that pregnancy and its complications is third after suicide, and in women actually winds up to be second. So if we look at a reason, in Texas, the firearm permits that were issued from 2005 to 2023 increased from about 100,000 Texans getting purchases approved of firearms to almost 500,000. And since most of the purchases were for more than one firearm, it's actually closer to 1 million purchases of firearms, individual firearms, in the state of Texas. Then if we superimpose the suicide rate of Texans in the 15 to 39 year AYA range, is superimposed on the firearm permit purchases, starting at 1,000 here in 2005 and going up to about 1,800 deaths from suicide. So if we do a correlation analysis using the most quantitative metric, the Pearson correlation coefficient, 0.91 out of a possible 1 means it's highly correlated and definitely suggests causality. So I'm sorry to have to support the network in this way, but it's crucial, and I want you to continue the very important work today and help not only Texas, but the entire country, and for that matter, the rest of the world. Thank you.
Thank you for your message, Dr. Blair, when you watch us back later. As you can see, the crisis for AYAs does not end with treatment. Ongoing psychosocial and health issues contribute to death, not just from the disease, but by their own hand. A comprehensive long-term support strategy is critical to help save our AYAs. Many of us in this room know AYAs who did not survive their cancer one way or the other. And in honor of them and the people who loved and cared for them, I would ask us all to take a moment of silence. Thank you. Frankly, I'm here today because I'm tired of watching my friends die, especially for preventable reasons. AYA cancer patients face a perfect storm of challenges at a pivotal part of life. They often experience delayed diagnoses due to misidentification of symptoms, like Ryan's STDs, non-existent STDs, a lack of health insurance coverage leading to more advanced cancers at detection. Treatment itself disrupts education and early career development, creating long-term financial instability. Many struggle with fertility loss, body image issues, and maintaining relationships during treatment. And the psychological impact is profound, with many feeling isolated from their peers and struggling to form their adult identity. Even if an AYA survives their cancer, the long-term impacts can be crippling. AYAs can avoid many of these long-term impacts of these problems if they have the right support. And that's where you come in. The AYA Cancer Foundation is launching a new initiative to educate the medical community and activate community resources to wrap around these young adults. The needs of AYAs far outstrips the resources of any one organization, but together we can create a support network to keep these young people from falling through the cracks. I would like to introduce you to the AYA Support Network. The AY Cancer Foundation is still in the early stages of developing this support network, but we're excited about the progress. And we'd like to we invited a few of our new partners to join us today in a panel discussion so that you can learn more about their available resources to AYAs in our community. Joining me to talk to our panel today is fellow AYA and award-winning hospice nurse, Stephanie Hartman. Go ahead and come up here. Let's bring you to the stage.
No.
Come on over here. Stephanie, tell us a little about yourself.
I just left my script over there. I am a 29-year-old nurse who was diagnosed with breast cancer at 25 years old. I have been in the medical field for 13 years, first as a CNA and now as a BSN. And both me and my husband are AY cancer survivors. I myself have received fertility preservation grant and a cost of living grant which helped both me and my husband whenever I was going through my woes of treatment. Fun fact, I have been both working as a nurse on the oncology unit and I've been a patient on the oncology unit at University Hospital.
Fun fact. And you were recently recognized as best in class hospice nurse by the San Antonio Express News. Isn't that right, Stephanie?
Yes.
I just wanted to embarrass her, so you're welcome. Next, I'd like to introduce you to our panelists. First is Dr. Allison Grimes. She is a pediatric oncologist at UT Health San Antonio and University Health System, where she directs the AYA program. She's also involved in AYA priorities nationally, including the oversight of clinical trial development in her role as vice chair of the AYA steering committee for the Children's Oncology Group. I know it's a lot. We're going to be hearing a lot from Dr. Grimes. So thank you, Dr. Grimes, for being here today. Next is Rhonda Roach, Program Administrator for the Early Head Start Program at the Department of Human Services for the City of San Antonio. Florentino Perez, Neighbor Services Outreach Manager at the San Antonio Food Bank. Welcome. Erin Erkeline, Executive Director of ThriveWell Cancer Foundation. My pal Chelsea Fellows, Senior Manager for Patient and Community Outreach at Leukemia and Lymphoma Society. And finally, to round out our panel, our own Dr. Jaime Estrada, founder and president of the AYA Cancer Foundation. I'm going to call him audible and just stay here so that you guys can use the extra mic.
Oh, sounds good.
Go for it. Well, I'll consider. Never mind. I just realized I have to carry like 3 things. It's all good though. All right. Go for it.
So I'll start with you, Allison. AYAs face very specific challenges and need to be supported in specific ways to overcome those challenges. You are one of the founders of the AYA program at University Hospital. Can you tell us about the way University Hospital supports us as AYAs?
Thanks for the question. We had a unique opportunity starting about just over 10 years ago when all of pediatrics moved over to University Health System, and we suddenly shared real estate with our adult colleagues. And within oncology, this immediately led to brainstorming and sharing challenges around our care of adolescents and young adults, challenges which our groups shared, our patients shared, and a joint recognition of the undercare and poor outcomes that these patients face, and what could we do together? What did we need to build, and where could we start moving towards this shared goal of improving care and outcomes for AYAs. And so, it started in a little conference room discussions, and very quickly over a period of a few years, just with invested folks volunteering their time, submitting grants, partnering with a group called Teen Cancer America in order to secure a hospital grant, which we were awarded in 2018, to create spaces for adolescents and young adults, because having a separate dedicated space that is that's age appropriate is really important. And then also to secure that space within the context of your care environment. So there is now an AYA lounge at University Hospital. It is embedded within the inpatient AYA cancer unit. And then that also led to AYA dedicated support staff for this population of patients, including an AYA nurse navigator and an AYA social worker. We asked for so much more, and apparently that budget was too big. So we have a long list of needs and wants and desires to get to that goal for our patients. I think that it's a work in progress, but I am really happy that we have been able to partner with the health system, with the academic medical center, to recognize that this population is important, that the time, the effort, and the investment is worth it and meaningful, and also that we have so much more to do.
That's awesome. And you do so much work on the national level with AYA issues, and you are a true expert in this field. As such, we have a few extra questions for you. So many AYAs are misdiagnosed as they tried to with him, and others receive just delayed diagnoses. What can we do as healthcare providers to recognize cancer in young adults and treat their cancer appropriately? What resources are available to institutions that want to become more AYA literate?
That's a great question. So I'm going to kind of approach this twofold. The first part of your question is asking about, what healthcare providers can do to better recognize that young adult sitting in front of you might have cancer. And I think my answer to that is we can listen. I think much of what is missed from the many patients that I personally have met, the stories like Ryan's that I've heard, really share a theme that they have often presented to multiple centers, multiple providers. All of this time has passed at the beginning of their journey, where someone on the other end just wasn't listening. And when you don't listen, then you can't identify what's happening. So, why were Ryan's symptoms not immediately alarming for a concern for potential hematologic malignancy? I mean, obviously, I'm a pediatric oncologist who treats leukemia, so that's the first thing I think of. But why would that not be at the top of the differential for someone else? And because there was a component of his story, of his presentation, of his exam, someone wasn't listening. So I just think that maybe that we all have a lesson to learn, and that more needs to happen there. But beyond that, the second piece of the question is, what resources are available? What can providers do to be more aware, to think about cancer in the young person? This awareness, improving knowledge is so critically important. And I think that that recognition that illness, severe illness, cancer can happen from birth to death, we miss that. And as a society, we don't suspect that young people are going to be sick. But I think that having events like this, community events that not only face providers, but also face just folks in the community who may be a young adult's loved one, really creates opportunity for anyone to be an advocate, Ryan needed an advocate. Other young adults that are beginning this journey and looking for answers and have concerning symptoms need an advocate so that you don't feel defeated when you may present to that initial center or that initial health institution and no one knows what's happening, or you just have a panel of STD tests that are run. And so improving awareness and advocating for that individual in your life who is the young adult that's looking for answers, anyone can do that and be that.
And Allison, you mentioned that when we talked previously that the NCCN has published guidelines for AYAs. Is that correct? That anyone can, how would people access that if they're treating AYAs?
Yes. So if we fast forward to the provider that's actually treating a young adult with cancer, everyone that is in that space should be aware of the NCCN, the National Comprehensive Cancer Network. And the NCCN publishes guidelines of cancer treatment that are specific to different diagnoses. Leukemia, for example, different types of lymphomas, solid tumors, brain tumors, et cetera. And so one, yes, it's critically important to know that those guidelines exist that are, based on how you should be treated and then after treatment into survivorship. But for patients and for families, there's also a sort of community-facing section of NCCN. You don't need to pay for a subscription, or anyone can access this. And there are specific guidelines in the NCCN for AYA cancer in general, regardless of what your diagnosis is, from diagnosis all the way into long-term care and survivorship. And that includes things like, at the time of diagnosis and prior to starting treatment, every AYA should be offered fertility preservation counseling and access to fertility preservation services regardless of ability to pay. Meaning an assumption should not be made about the patient and whether they have access for funding for this thing and then the information not provided. All patients should have access and should be referred for fertility preservation counseling. For genetic counseling, for example, and I would take up the whole panel discussion if I went on and on, which I'm already getting like the ear pull. But please, if you're not familiar with that site, go to the NCCN, look at the NCCN AYA cancer care guidelines for all patients. And then also for some specific diseases, the treatment guidelines are different for AYA as opposed to older adults or younger children. And one example of that is leukemia. There are NCCN AYA specific guidelines for the treatment of ALL. So that patient like Ryan with PH-like ALL at the age he was diagnosed should not be treated like a young child is treated or like an older adult is treated, but per those guidelines for AYA ALL.
And as a survivor myself, what resources are available for us? I know you touched on the survivorship clinic. Can you tell us a little bit more about that?
Yes, lots of resources available in an environment where it feels like nothing is specific for you. So I recognize that those resources can be hard to find. So like, where do you look? How do you navigate that? There are community-based resources specific for AYA cancer patients, and then lots of online resources that AYAs have access to here in this community in San Antonio. So speaking to the survivorship clinic, at University Health System and then also at Mays Cancer Center, there are survivorship services for AYA cancer patients. At University Health, it serves patients that might be more childhood cancer survivors or diagnosed as a younger AYA or were treated within the system there. Patients that were diagnosed as an older AYA, so maybe in their 30s, or that were originally treated in the adult setting, might be a better fit for the survivorship clinic at Mays Cancer Center that has a slightly older AYA population. But both provide long-term survivorship care for AYA cancer survivors.
Allison, how many years would you say you've been trying to get me to make an appointment at the survivorship clinic?
Well,
Like
we don't need to.
10? Okay.
I'm working on it.
Okay, excellent.
Coming up.
I'm still trying to get my referral. After cancer, I was supposed to get set up for radiation, but I did the math and I was going to turn 26 after the first few sessions, meaning that I wouldn't have the insurance coverage anymore from my mom. So I decided not to get radiation because I couldn't afford it. This being said, access to care is one of the big hurdles that AYAs face. As we learned last year from Dr. Blyer, the Affordable Care Act has made a massive positive impact on the survival rates for AYAs. What is University Health doing to support uninsured or underinsured AYAs?
First of all, that should not have happened to you. You qualified for other funding support in order to receive the radiation therapy that you receive. I hope that one of your takeaways is that just no is not ever the answer. It just means go somewhere else and keep asking the question. And AYAs face a lot of walls and barriers. And I'm hoping that a little bit of what's provided today can help break down some of those walls and barriers. But funding is a huge barrier. And when the funding you have in place is lost, you age out, it is not the end, and that does not mean that your healthcare support needs to stop. There are many other options. One of them is CareLink, and many folks that have been in this community for a really long time may not be familiar with the CareLink network, but if you are a resident of Bexar County and have been for at least 6 months, you may qualify for funding support for CareLink. And this would include cancer care, radiation therapy, and all of your supportive care medications, your hospitalization, your outpatient visits and infusions, in visits not just with the physician, but for other subspecialists, for your psychologist, and everything in between. So don't feel like you can't receive those services, or if your current funding doesn't provide coverage for that, there may be other answers. So just keep asking the question. There's a CareLink office, so like physical office at University Health, but also there's a phone number and other locations where you can connect with a CareLink counselor. And if you, for some reason, don't qualify for CareLink, within that office, they'll partner you with a group that assists with identifying what other funding coverage you may qualify for, and then help you with the application process.
Thank you. That's awesome, Allison. And Rhonda, I want to switch over to you because you have a very personal story about CareLink. So before you talk about your work with the city, can you share a little bit about that?
Sure. Make it a little emotional. Not as colorful as your story, Ryan, but I'm so happy that you mentioned CareLink. I moved here to San Antonio in 2005 as a full-time graduate student. And 2 months out from my graduation, I was given the diagnosis of cancer. Rocked my world. I did not have insurance. I did not have family here. And I really began to wonder what was going to happen next. When the doctor said I needed to have surgery within 3 to 4 weeks, that rocked my world, and started going through the process of the next steps that he recommended. But because I was considered private pay, I didn't qualify for other type support programs. Doors were not opening, and I was my only advocate and just kept pushing. Then one day my doctor called just to follow up. How's it going? What is your next steps? When are you going to have your surgery? And I said, I haven't had access to a doctor. He said, that's inexcusable. He said, I will call you back. He called me back in about an hour, and he said, you have an appointment at the Mays, but what's at that time, CTRC, the Cancer Therapy Research Center. And I went in to see this doctor, and as the nurse was doing the intake, she leaned into me and she said, Rhonda, call this number. And I said, what is this number? And she said, it's the CareLink program. I said, I don't know what CareLink is, and I've never heard of it. She said, call the number. It's a program I believe you will qualify for. I called the number, and basically they said, yes, we can get you an appointment in 3 months. And I said, you don't understand. I can't wait 3 months. And she said, well, I shouldn't tell you, but if you go to a clinic and wait outside before they open, they may see you. And the next morning, I was there at like 6:30 in the morning, and there was already a line. And that spoke so loud to me. I'll fast forward and say that I did that day receive CareLink, and within 3 weeks, I was having the surgeries I needed and the care I needed. And a year and a half later, I was employed by the city, and I was able to roll off of CareLink. And I, to this day, am a champion and do contribute to CareLink saving my life. So I am a supporter, huge supporter.
Thank you so much, Rhonda, for sharing that very personal story. Thank you very much. I was fortunate in a lot of ways to be diagnosed as a teenager when I didn't have as many responsibilities as I do now as a mother with 4 young children at home. If I was diagnosed now, it would be a very different story. And many of our AYAs are having to decide, what do I do with my kids while I'm at the clinic getting my treatment? Because I can't bring them with me. And some people have support, but many do not. And serious illness is one of the risk factors for child welfare involvement, and that should never be on the table. So what is the city doing to support families in crisis like that?
So I don't know that you may know, but it's important for me to share with you that the city of San Antonio has a compassionate charter. We are a compassionate city and labeled as such, as well as each one of our departments as an organization is going through a lengthy process, but a process to become trauma-informed and certified in trauma-informed care. I'm proud to say the department I'm in, Human Services, we have obtained our Level 1 certification and are working to continue pursuing Level 2. And with that comes a different approach in how we work with our citizens and our community, and also how we view our programs. Just within our own department, when I think of childcare, emergency childcare, we have a program called Our City Cares. And all the programs I'm going to mention, yes, there's eligibility criteria, but there's also emergency response. And our City Cares program, it is funded through our general fund. It is an emergency response. Medical is one of the qualifying criteria for a parent or guardian. It is a short week or 8-week process, but that may help some families get through what they're facing. We also, within our department, we have programs through our financial assistance, our family assistance program. We specifically have a program called Next Level, which is geared toward opportunity youth. That's 16 to 24 years of age. And this is really casing and working and navigating, helping that individual in whatever capacity their goals or needs may be, connecting him to the resources. We also have our Head Start and our Early Head Start program, our senior centers. Families are unique in their makeup. We never want to just say, oh, you don't fit that age group, because when we look at our families and our community and our citizens, it is the city who is wrapping themselves around programs. Our Metro Health has programs. I would just say, go to the city's website, sa.gov, Human Services, and you have a wealth of information and resources. There is a wonderful community resource right on our webpage that I spent time just maneuvering recently just to learn more about, and I can't celebrate it enough and what it brings and how easy it is to utilize.
I think you're talking about Sacred with
Yes,
Bill
I
Neely
am.
back there. You can
Yep.
wave.
Yes.
It's an amazing community resource directory.
We use it every single day within our department. Yeah.
Thank you. I want to also mention, especially for you AYAs that are in the room, that VIA, who couldn't be with us today, but they also have discounted transportation available, and AYAs qualify for it. So you just go to the VA via website, and you can fill out an application for that. Those of you who work with AYAs, it's another great resource to handle. One of our other community partners who wasn't able to be here today because they had a leadership event this weekend. It's Catholic Charities. They also do a lot to support young adults and families in crisis. So it's another great resource and part of our network.
And as we heard just a little bit ago from Ryan, sometimes AYAs struggle to buy groceries, and we have Florentina Perez from the San Antonio Food Bank here. They have a whole network of food pantries in the city. Can you tell us about your food programs?
Yes, thank you for the question. So at the San Antonio Food Bank, we have different programs that range from food assistance, utility assistance, and assistance with obtaining a job. So right now I'm going to be talking about the food programs. Thank you to our community partners. We're able to distribute thousands of poundage of food each week and each month to the community in Bexar County and the 29 counties that we serve in the Southwest Texas region. The main two food outlets that we have are food distributions and also food pantries. So for the food distributions, these are on a larger scale. So maybe you're driving by like a school, a library, a senior center, and you may see like a long line of cars against the sidewalk or the parking lot. That means that food distribution is happening. People can access these distributions every 2 weeks. I do have some flyers on my table and back there with the website and the instructions on how patients, clients, or anyone that you serve can access these food distributions. The website is called Fresh Track. That is fresh and then trak.com. It is a very simple website to navigate through. All they have to do is type in a zip code, and it'll show them all the available distributions that are happening that same week or the following week, and they can just go and they'll get registered on site by a volunteer or the point of contact of that site. Now, on a smaller scale, we have our food pantries. These are all over the city of San Antonio, and again, the 29 counties that we serve. Again, this can be like a school, a closet in the library, another like senior center. So yeah, these are on a smaller scale. Basically, the food trucks go out there every week or every 2 weeks to deliver food at those sites. And then the person in charge of coordinating that food pantry will determine the days and the times that anyone can go to pick up food. Now, for the food pantries, that is not public information. So y'all as community advocates in the community, y'all can refer clients to us through our e-referral partner program. I do have flyers for that as well. So you can go on our website, type in the client's information or the patient's information. My team and I will receive it and we'll contact them within 24 hours to share any information about food distributions or food pantries in their areas. So those are the two main food outlets. If we want to go further than that, we also have, my team and I were case assistance navigators. So we help families apply for SNAP. As you all know, SNAP is the formerly known as food stamps. We have SNAP for anyone, and then we also have TSAP for those who are 60 and over. We're contracted by the Health and Human Services Commission, so we are trained to help people fill out these applications, submit documents, and as navigators, we follow up with them until they finally get a response from the state. We also have farmers markets. We have food programs for seniors, low-income seniors like Project Hope or CSFP. You may be familiar with those programs since some senior sites have that. But yeah, those are the main takeaways that I want you to get. Again, refer clients to us, and we'll be sure to connect them with those resources here in Bexar County.
Did any of you learn something about the food bank today? You think food bank, you think food, right? But I just want to underline this because you guys provide that immediate support. But as we've talked about, AYAs often face long-term financial instability, and so you call them what did you call them? The case navigator?
Case assistance navigators or CANs, yeah.
And they'll follow someone for a long period of time to help them with apply for government assistance and job security stuff. Like that's a lot of really cool work that's happening at the food bank in our community. So I just wanted to make sure to highlight that. Okay. Thank you so much, Florentino, for sharing that. Oh yeah, you can pass it down. Oh, did you have something else? Oh, sorry.
I did. Sorry. I thought
Yeah,
I was gonna
go,
go on the next
go,
question.
go.
Okay. So as like I mentioned in the beginning, aside from food assistance, we also have our amazing referral partner program, also known as RPP. For example, once one of my teammates or I or myself, we finished doing an application, we asked them, okay, we got you with the application, we got you with food. What else do you need? So they may say, oh, well, I have a baby. I'm struggling to buy diapers. I'm struggling to buy formula. I can't pay my rent. I can't pay my light bill, water bill. That's when the referral specialists at our office come in. We necessarily don't provide those resources at the San Antonio Food Bank, but we're an outlet to connect to connect any available resource in Bexar County with our clients. That way they can get the assistance that they need. So it's very simple. They'll just come in, they'll sign a consent form to join the program, and the referral specialist will assess them that day. And then once every quarter throughout 12 months to ensure that they're doing good and that they're not needing anything else. Lastly, we also have our Ready to Work program that is funded by the city of San Antonio. We have a group of case managers that do client intake. They assess them on what they want to do. We provide training for them for IT, healthcare, warehouse, culinary. Once they complete the program, they'll work to build their resume, and they'll also work to finding a job for them. The goal is to get them a job that will pay them at least $15 an hour, but I've seen that they've helped our clients get a job that pays them up to $34 an hour. So I think that's amazing work that we're doing, and it goes in our Food for a Lifetime pillar, because food for today will be our food distributions, food for tomorrow will be food stamps, and food for a lifetime will be getting a job so they can be secured for a lifetime. So thank you.
I just want to feed off of, thank you so much for mentioning the Ready to Work. Through our City Cares program, we are piloting and working through to help support those in the Ready to Work program with childcare through our City Cares. So it's a mutual work that's being done. So yeah, just wanted to mention that.
Oh, isn't that great? Thank you. That's awesome. Here, I'll give that to you. Thank you so much. I want to turn to Aaron. The ability for AYAs to really survive and thrive beyond their illness is really the heart and soul of what Thrive Well does. And that the holistic support around a patient is really critical for that process. So could you tell us a little bit about the supportive services that AYAs can access through Thrive Well?
Sure. So I'm with Thrive Well Cancer Foundation. We were founded back in 2007 by a local oncologist who still is practicing. And she saw a real need in the community around exactly what you're talking about, support services and really tangible programming for folks who were going through their own treatment journey. We provide financial assistance, transportation assistance, and lodging assistance to folks who have to travel into San Antonio for their care. So if you know folks who are struggling, please, please, please tell them to get in touch with us. We have cards and stuff back there. But our support services, we call our Diva and Dude program. It is a free exercise, nutrition, and wellness program that's offered at multiple locations across the city. We're offering upwards of 60 classes a week, nutrition, exercise. In conjunction with those super active classes, we also are providing now individual therapy, group therapy for both the patient and the caregiver in the family. And then we also just launched a couples therapy program. So what we really aim to do with that program is, with our patient assistance program, that financial, transportation, and lodging, we're carrying folks through their treatment, and then into survivorship is that Diva and Dude program that anyone who has ever faced a diagnosis, whether it is you're just newly diagnosed and you want to engage with folks who are walking it and getting it just like you are, to folks who are 15 years out and cancer, their diagnosis is in their rearview mirror, but they're just looking for ways to stay super active and keep their cancer at bay. The whole reason that that program was even started is because the research back in 2007 was piling up about the benefits of exercise and nutrition for women specifically with breast cancer who had gone through conventional treatment. They saw that if they exercised 3 to 8 hours a week and stuck to a pretty healthy lifestyle in terms of their nutrition, they could cut their chances of recurrence by up to 50%. And what we knew at the same time was that big pharmaceutical companies were pumping billions of dollars into drugs that reduce the chance of recurrence by 2 to 3%. So here's this thing that patients and families can take some real agency around their health at a time that feels totally uncontrollable. So again, but all of our programs are offered at absolutely no cost. So everything that everybody's talked about already, we are working hand in hand and really looking and aiming for a complete wraparound with these families, because not just the patient gets the diagnosis, it impacts the entire family. And for AYAs, what we are learning now through our work with Dr. Estrada and everybody else who's sitting up here and in the audience is there's some really unique needs. And so for Ryan, we would have stepped in and paid for that collection and for the storage. We really plug in to whatever that patient needs for that financial assistance. Most often what that does is pays for copays and meeting deductibles and those kinds of things, but because we're so small, we can be really nimble about how we provide that financial assistance. So what I always encourage, especially folks in healthcare, if you've got kind of a weird situation that has come up with a family, just reach out to us. We're, again, super small. When you call the office, you get one of us, and we can answer questions and really activate around that family immediately. So I'm happy to take questions if we have time at the end, but we're here. We are here to be of service. We are hyper-focused on our local community, and we take care of our people here. So that's us.
Thank you.
I just have to say, I myself am a breast cancer survivor, and that hit a little too close to home for me.
We have a couple in the audience. They'd love to talk about it.
Diva and a dude. So we're both.
For sure.
So I had no idea, especially about the therapy. That is something that I've had to take care of on my own. That's something my husband's gone through, and it completely, I was blown away when you were saying that, and I'm trying not to get tearful right now, but it's awesome. So thank you.
The other thing just to mention is these are all licensed clinical folks who are working with our people. Our exercise instructors all have certifications on their specific exercise focus, but also working with oncology patients. All of our therapists are licensed in their area of focus. So this is all free and available to anyone who has ever faced a diagnosis. With our dudes, we do personal training, all for no cost. So there's all kinds of support and opportunity to not only reap the benefits of living a healthier lifestyle, but having a group of people who rally around you every time you walk into a class, anytime you need anything. It's really become this beautiful community of support. So I would highly encourage, you gotta join. You gotta join.
Isn't it wonderful just having so many to just even have this conversation? And I just want to credit Dr. Estrada for saying yes to this idea of sharing the stage with other organizations in town so we can have this conversation. And it was funny, last year at the luncheon, Chelsea, you and I were talking oh man, I wish we could have shared what Leukemia and Lymphoma Society can do for AYAs and for survivorship and all those things. And the Leukemia and Lymphoma Society has really been on the cutting edge of advocacy for AYAs. And they actually helped fund and author the NCCN the NCCN guidelines for AYAs, but they do so much more. So could you tell us a little bit more about what programs AYAs can offer through the Leukemia and Lymphoma Society?
Absolutely, thank you. Very excited to be here. So yes, Leukemia and Lymphoma Society, we support patients with leukemias, lymphomas, myelomas, but we do know that our young adult survivors are facing some pretty specific challenges. And so we've put together different resources that might resonate with some and not with others, but really trying to provide kind of a holistic approach for families going through a diagnosis. One of the things I want to mention is our Information Resource Center. They are guides and navigators. So when, especially young adult is newly diagnosed, you're talking about with the insurance, some of those questions you can call the Information Resource Center and they can help guide you through any of those questions that you might have, even questions about what the diagnosis is, or if you have your blood work and you have no idea what the acronym means, even things like that. They don't provide medical advice, but they do just give you an opportunity to talk with another healthcare professional. Another great program that we have is our one-on-one mentoring program. So if if there's any survivors here, if you'd like to talk with another survivor, or if you'd like to be a mentor to other survivors, we match survivors based on age, diagnosis. We can get down to even treatment, especially with all of the new treatments coming out. That's been a huge question. We will get patients, maybe they had CLL, they were watch and wait, but now they're going into active treatment. Well, we have volunteers who have been through that. We have volunteers that speak Spanish. We even have some that speak Mandarin and French. And so just being able to connect with other mentors. If you're not comfortable with a one-on-one, we've got virtual as well. They are broken up online by diagnosis as well as aside for young adults. It is also, again, monitored by our Information Resource Center. And so even though they're sharing information, the master level social workers and nurses are monitoring to make sure no misinformation is going through, so you know that you are protected, and they'll reach out if there is any signs of distress. Some other really great programming that we do, we have tons of education programs online. We have podcasts. This coming fall, I will be putting together a half-day seminar on cancer survivorship with a very specific breakout that will focus on young adults. And so I will definitely be sharing that with the team here to have everybody, invited and welcome to attend. All of our education programs are completely free, as well as all of our other resources. We have a new case management medical debt program. I have a young adult survivor, and she was so excited. She's several years out of treatment, but she's still digging through the medical debt. And so she told me that just being able to do this medical debt case management and getting everything organized and to really understand has been hugely impactful. She's trying to pay for a wedding, but she still has this many years out of treatment still hanging over her, and being able to work with our case management team to get it under control and to set up a plan has been just absolutely life-changing for her and her fiance. If we have any young adults who are wanting to go back to school, or their school was interrupted, or even if you were 2 years old and diagnosed and now you're 18 and getting ready for college, we have a scholarship fund at $7,500. Definitely want to make sure that all the families have that opportunity to participate in that scholarship. I think one of the greatest things about what my role is I cover 92 counties in Texas, so pretty much the bottom half of Texas. And so I get to work with organizations not just here in San Antonio and Bexar County, but in Corpus, in the Valley, in Laredo, all the way up to Midland, Odessa, Waco, Temple, Killeen, and San Angelo. And I get to hear stories from healthcare professionals and from patients from all of these areas. And the stories are different, but there's always a struggle, right? And so that's what we're trying to do, is just here's what the struggle is. Do we have a bridge to help them cross that gap? And so one thing I would love to close with is I love, that's one thing I love about my role is collaborating. And so always happy to, if there's any healthcare professionals, if you want me to come in and do a lunch and learn, I'll bring lunch and little goodies and giveaways and tell your staff about the resources we have for not only their patients, but also the resources that we have for healthcare professionals. You can get your CEs if you didn't know, and for free. And so always happy to come in and do those lunch and learns. I was talking to a nice woman in the back, and I'm hopefully going to get to do one for Zoom. I'm doing a statewide one with text oncology in June. And so that's what I love. I love having a good lunch. So any community partners, if you'd like to go to lunch, I'd love to hear how, you know, cancer is impacting where you live in your community. If you know anybody in these outlying areas that I also cover and you want to make that connection for me, I would love that opportunity also, just so everyone can know about what we have. But thank you so much for bringing this all together, and just really excited to be here. Thank you.
Thank you so much. And bringing it back to the man that started this mission, what are you doing to support current AYAs that come to you today?
Well, first of all, I'd like to thank all of you for participating in this panel. I see a great opportunity to develop a program to support our AYAs. There's a great need out there, as you all know, and you are all doing your part on helping them. So what we will continue to do is providing the services, the financial help that we are doing, because that's needed. Providing cash for them to put food on their table, it's important. Providing funds to pay for their fertility preservation procedures. And I know there is now a law that forces commercial insurances to pay for these procedures. But those are for the ones who actually have the coverage. The ones who don't, you know, they are in trouble. For example, we just had a request from a patient, from Dr. Robinson, a 17-year-old girl who was diagnosed with ovarian cancer, and she was covered by Medicaid, but Medicaid was not going to cover for the fertility preservation. And it was clear from his request that this young person was going to become infertile with treatment. So she needed to have her eggs collected, frozen, and stored. And of course, the family didn't have the money. We actually didn't have the money also, but we were able to find a couple who was generous enough to provide, to be sponsors for this young person. So, and in this regard, I would like to give a shout out to Erin and Tribewell, because they have collaborated with us in covering for the cost of several of our patients who needed to pay for the fertility preservations. So we'll continue to do that. Hopefully, this program will get off the ground. I think there's a lot of community support. And so that eventually we believe that this could become a model for other nonprofits, cancer nonprofits, not just in Texas, but also in the country. And so that, I think that would be our purpose.
And what does the future for the AYA Cancer Foundation and the AYA Support Network, what does that look like to you? And what will it take to make that vision a reality?
That's the question. You know, what it would take to make this a reality, and you have to think, and you have to say that it has to be financial support, because without financial support, you just can't do anything. You know, so we need the financial support from the community, from organizations, from foundations, so that we can develop this program the way it needs to be developed. We're talking about having its own website to be able to hire a person, a trained person, to manage this program, to be able to receive the request for help, to be able to connect this request with the organizations out there who are going to be able to provide the help to the patients, and so on. So we need the financial help to be able to do this.
Thank you.
Thank you to the whole panel. I wanted to really encourage you to talk to these people afterward. I told them, we could spend so much time doing a deep dive into any one of these organizations, and I encourage you to do that. We just couldn't, do it on stage. Everyone would be pretty tired by the end of that. But go see the exhibitor tables after. Go find some of these people in the audience and talk with them. They want to hear from you. But I do just want to recognize them and give them a big round of applause for standing in the gap for AYAs in our community. If you represent an organization, or if you're an individual that would just like to volunteer to be part of this network, you can scan this QR code and fill out this. It's a fairly detailed survey, so you might want to scan it and then tag it for later. But it's just so we can kind of keep all that data organized. But you can do that right there. And I wanted to one more time thank you so much to our panelists for giving up your Saturday to be here and to be part of this network. We recently asked a few of our AYA survivors what advice they would give to a newly diagnosed patient. And I want to share with you what they had to say.
Hi, my name is Carly, and I'm an AYA cancer survivor. I was diagnosed with acute myeloid leukemia when I was 16 and then again when I was 19. And something that I would tell someone who is just diagnosed with cancer as an AYA patient is that a positive attitude is the greatest thing that you can have. It's going to make the hard days a little bit better, and it's going to make the good days great.
Hi, my name is Kyrie. I am 35 years old, and when I was 10, I was diagnosed with leukemia. And I went through chemo and radiation, relapse, and had a stem cell transplant. A lot of time has passed by since then. I'm married. I have a good job. I went to school. So I didn't let my past hold me back from living a fulfilling life. I would like to give some words of advice to anyone who's battling cancer. The first one would be to have a good support system. Lean on your family and friends when you are physically and mentally incapable of doing that on your own. Another one would be to have confidence in yourself. Going through treatment is very demanding on your body as well as your mind again. And it's easy to kind of it's easy to get lost in our thoughts, and you just have to gain confidence every treatment that you get, every doctor's visit, and continue going in a good trajectory for the success of your treatment, which kind of blends over to the last thing that I want to share is staying positive and continuing to have hope. Always having a positive mindset will help you get through this, even when it seems that all odds are against you, which in my case, I was one of those examples, and if I could do it, you can do it. So that would be my advice, is to never give up and continue to have hope. So I wish for anybody who's dealing with cancer the best in your journey. If you need any support or have any questions, feel free to reach out to myself or any of the AYA support groups. And we wish you the best. Thank you.
Hi there, my name is Dulce. I am an AYA who was diagnosed with and survived Ewing sarcoma. If you've just heard the words, you have cancer, I want to acknowledge how overwhelming this moment can be. It's okay to be scared. It's okay to feel lost. It's okay to even be angry. This is a tough road, and it's normal to have every single kind of emotion. But I also want you to know that while the path ahead may have bumps, there will be flowers all along. Moments of hope and kindness and even unexpected joy. Sometimes it might feel like you're walking this journey alone, but just remember that you have an army surrounding you, your family, your friends, and even your medical team who is cheering you on and fighting with you. It's okay to be tired. It's okay to take breaks. Take as many breaks as long as you need them. Rest is part of the healing journey. But your life is worth fighting for. You have a ton of warriors waiting for you at the finish line, myself included. I know from experience that there will be hard days, but there will also be days of strength and resilience that will surprise you. I'm cheering you on. I love you. And remember, it's going to be okay. You're stronger than you know, and you're never alone.
Today, the future of an AYA is in your hands. Today, you can help decide how many AYAs will get life-saving financial support they need this year. The grants from the AYA Cancer Foundation put immediate cash into the hands of AYAs in crisis so they can stabilize as they seek that long-term support that they may need. And you can ensure that they are not alone. Our goal today is to help replenish the AYA grant support fund and to raise $10,000 in order to replenish this fund, because they will receive requests from all over the area, as Dr. Estrada said, and that money will help fund some of these urgent requests. I'm going to list off some different levels of support, and when you identify the impact level that you want or are able to make today, I'd ask you to raise your hand and complete the donation form that you can get when you scan that QR code. There's also, it's the same button on your virtual program if you already have that pulled up. And if you need help with any of that, look for people with the volunteer lanyard and they can help you. But this first level is $1,000 for a fertility preservation grant. This helps to cover the preservation and a year of storage for male AYA patients. $1,000 helps to make a dent in the cost of fertility preservation for females, which is much more expensive at $9,200 on average. But you can be the reason that a child exists in a few years, that an AYA's genetic line doesn't end with cancer. So you can go ahead and scan that QR code there. The next level is $750 for emergency housing. Because many AYAs cannot work, they face housing insecurity. And one of the first living expenses grants that Dr. Estrada made was to a young man who was living out of his car, right, while he was diagnosed with cancer. And the grant was able to get him into an apartment and stabilize him and get into a safe place while he was on treatment. And I think it's important to point out that while the city does have affordable housing programs, the wait lists are often 8 to 12 months long. And that's just not a short enough time frame for our AYAs who often need that emergency housing assistance. This next level is $500 for utility bills. You can help keep the lights on for an AYA with cancer and make sure they have hot water and AC in the middle of the summer. Would ask you to not make our AYAs choose between paying for life-saving treatment and keeping the lights on. At $250, you can help support the transportation for an AYA. You can help them have reliable transportation to treatment. A lot of these treatment schedules require them to go to the clinic almost every day. And $150 can help remove that fear of not knowing if they can afford gas to make it to the clinic. And we recognize that there are all kinds of miscellaneous needs that AYAs have, and $100 can help to fill in some of those gaps. So that unexpected expense where you have to call a plumber to have a service call come out to help to pay for some groceries that they couldn't maybe find at a food pantry, that $100 household needs grant can go to support that. And finally, if you may not have financial resources, but you have time, or you're connected with an organization that you think would be a good fit for to be part of our network, you can, again, join our support network here. And this could be for things like pet sitting. Ryan, if you had had a pet when you were in the hospital for 35 days, like, that would have been a struggle. Like, who's going to watch your pet? A lot of AYAs aren't allowed to clean because their immune systems are so suppressed. So can you volunteer to maybe clean someone's home? But again, if you're part of an organization or that can help fill in some of these gaps for AYAs, you can join there, and you can take a couple minutes to fill that out. But I want to thank you again for being here today, for standing in the gaps for AYAs, because I want more weddings and birthdays and babies and fewer funerals. And ultimately, you can make that difference. So thank you. I want to give you all a hand, give you guys a hand for being here today. Thank you so much for everything. And just a couple of housekeeping things. Before we close. First, I want to let you know that this was recorded today. So if you're connected with an organization that you think would really benefit from having this education about AYAs, we'll be sending out a link to this video resource to you after the event, and feel free to share that as widely as you want. And second, the silent auction will be open for 5 more minutes. So let's see. Well, we'll make it a nice round number. At 1:30, the silent auction will close. So if you want to get your last minute bids in, you can go do that here in a second. And finally, before we end, I did just want to take one more moment to honor Dr. Jaime Estrada, for sacrificing his retirement to help support young adults and for bringing us all together today. Thank you. Thank you again to our board, our volunteers, our sponsors, and you all for coming, and have a great rest of your afternoon. Take care.